Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
Hello, doctor. My name is Laura Renault and I am 38 years, 37 years.
Okay, how may I address you?
Please call me Laura.
Okay, Ms. Laura, can you please tell me in your own words what brought you here today?
Yes, doctor. For the last few months, I have noticed that I am passing more bowel than usual, and it is increasing day by day. So I visited my CP. First, he thought that it might be due to some stress at my work because I am an actress and I had to work a lot, especially
Yeah.
at my early career stage. So he thought that it might be due to stress. He gave me some relaxing tablets, but that is not helping me. That my problem is getting worse day by day. And he also ran some blood test and he said that there is something abnormal. So he sent me here.
Okay, I will try my level best to find out what's causing you trouble. May I know that did this change in bowel motion come along suddenly or gradually?
Gradually,
Okay, how many times do you have to open up your bowel now?
about 3 to 4 times a day.
Okay, can you please tell me more about your bowel itself? What is the color of it?
I think
Normal?
color is normal, doctor, but it is loose and more watery.
More watery. Okay, and okay, it's have you ever observed its consistency? What consistency is it?
Loose and soft, doctor. Watery.
Okay, okay, it's watery. Okay, have you ever found it difficult to flush out?
No,
Okay, and have you ever noticed any mucus in it?
sometimes.
Okay, any blood?
No,
Okay, and have you ever noticed that you have to wake up at night for passing your bowel?
sometimes.
Okay, and okay, and may I ask you that have you ever noticed that is there anything that makes you better or worse?
No, doctor.
Any specific timing that makes it better or worse?
No,
Any specific type of food have you found that makes it better or worse?
no, doctor.
Okay, and okay, and may I ask you some other questions now? That do you have any raised temperature?
No.
Okay, any loss of weight?
Yes, doctor. I lost a quite bit, about 3 kg over last 3 months.
Okay, okay, and any weather preferences?
No.
Okay, what about your appetite?
Appetite is good.
Okay, may I ask you some other questions now? Do you have any headache?
No.
Okay, any changes in your vision? Any problems in your vision?
No.
Okay, any oral sore?
No.
Okay, any rashes anywhere in your body?
Yes, doctor. I have some rash, and they are quite painful. First, I thought that this would be more due to some allergic products. You can see that there are some rash, and it is also present on my around my buttock.
Okay, okay. May I ask you for how long has this been present? This rash?
For about last 1 month. I tried
Okay, is it
few
painful?
hospitals, but that is not helping. Yes, doctor. Pain.
Yes. Okay, is it itchy? Have you found it?
Yes, doctor.
Okay, and okay, has it been same or has it been increasing or decreasing?
Increasing.
Okay. And may I again ask you that do you feel that is there any specific type of food like rice or bread that makes it worse? Your problem, your bowel motion.
I didn't notice like that way, doctor.
Okay, okay, that's all right. At this moment, I would like to examine the patient.
Okay.
His anemia, eyesight.
Yes, mild anemic.
Okay, mild anemic. Oral soreness.
No.
Okay. Any soreness around the mouth or any angulochelosis or glossitis?
No, you can see here.
Okay, and then I would like to examine the rash that was present. Have a look at it. It was mild, itchy, and I think pruritic. Okay,
Painful.
and reddish in color. Okay, and now I would like to examine his tummy, whether any pain present or not.
No.
Okay, may I ask you some other questions now?
Okay.
Do you have any history of any previous illness?
No.
Okay, any medication that you have been taking?
No.
Any over-the-counter or medication?
I just take some contraceptive pill, nothing else.
Sorry.
Contraceptive pill, nothing else.
Okay. That's all right. May I ask you some personal question now?
Okay, doctor.
Okay. Do you smoke?
No,
Or do you drink alcohol?
no.
Okay. You to say that you took some contraceptives. May I ask you that have you been ever been pregnant?
Yes, doctor. I have 2 children.
Okay. Any loss of pregnancy?
No.
Okay. And what about your? May I ask you that do you have any family history of any known disease, like any important disease like thyroid disease or heart disease?
Yes, doctor. My mother had thyroid disease.
Okay, that's all right. Uh, uh, okay, that's all right. And may I ask you that? May I ask you
2 minutes
now that?
remaining.
Yeah. What do you do for a living?
I'm an actress, doctor. I told you.
Yeah. And is your symptoms hampering your life now?
Yes, doctor. I had to go to travel a lot because for this audition and also for some character purposes, and also this rash that is also making my appearance very bad.
Yeah. I can get it. And okay, at this moment, may I know what your concern is?
Why I am having this, doctor?
Okay, actually, I think that at this moment, mm, as long as I have examined you and taken history from you, I think you are suffering from a condition named celiac disease. Okay, don't bother. Have you ever heard of it?
No.
Okay, don't bother about the term. Actually, it's a condition in which your cells can act as foreign cells. Okay, and it can damage your own cell linings in the gut. Okay, in your gut, linings in the gut, and you can have some changes in your bowel motion, and sometimes also you can have some oral sore or this type of rash that you are having. However, we have to confirm it some by doing some blood tests, and we will also involve the gastroenterologist in this case. And the for the treatment, actually make you some dietary modification as well. You might have to stop eating some type of food like bread, rice, these. And for skin purpose, for the skin condition that you have, we might prescribe you some specific medication as well. Are you
Yeah.
getting me? Yeah.
So, what do you think the diagnosis for this lady?
uh, I think the diagnosis is celiac disease along with dermatitis herpetiformis.
How you investigate her?
First of all, I would do like some complete blood count with ESR and CRP to rule out any inflammatory condition present or not. Then I will also do stool routine microscopic examination, and also iron profiling on vitamin D and vitamin B12 and folic acid level. And then I would go for specific testing uh, anti-tissue transglutaminase antibody. And I would also like to examine the thyroid status, including TSH, FT4 level, and if needed, I might do skin biopsy for direct immunofluorescence test as well.
What do you expect on the biopsy or on endoscopy?
On the biopsy, I forgot to tell. On the biopsy, I would expect I think I think on the biopsy, I've forgotten now.
Atrophy of the villi.
Well, actually, this villus atrophy, I think that it's in the gut. I'm not sure whether I think I will find it in the skin biopsy. I'm not
I
sure.
told you
How to
about the
do-
biopsy on endoscopy.
Oh, sorry, biopsy and endoscopy, there is this subtotal villus atrophy.
Okay. And
Okay.
lymphocyte infiltration.
Yeah.
Okay. So how will you manage her?
For patient education and counseling, uh, involving the multidisciplinary team involving occupational health service, also a nutritionist and gastroenterologist. Then we might actually give him dietary modification by stopping uh, uh, provoking food like rice, oats, rice bread, etc. And uh, and we might have to give Dapsone for his skin condition as well.
Okay. And how will you follow up her?
I think I will have to do the follow up by doing that tissue transglutaminase antibody level. I'm not sure about it.
Okay. Actually, this case went fine. You did well.
Okay.
Just one thing: rice is a treatment, not is an exclusion.
Okay. So then what were exclusion? I have just forgotten.
Okay, so you shouldn't mention what have you forgotten. You were doing wrong on this way. You
Yeah,
were
yeah, yeah.
you were talking about the exclusion of rice.
What should be excluded? I have just forgotten. Can you remember?
Wheat, rye, food
Okay. I
products.
have just reversed it.
No problem. Okay, I'm going for the next
Okay.
activity.
I think I have made one mistake by not telling the biopsy. Endoscopy and biopsy should be duodenal biopsy should be the gold standard.
Yes. So I
That was
asked
a
you that
wrongdoing.
what was your finding? Yes.
Yeah, and duodenal biopsy, I think it was wrong not to say it. You told it. I told about skin biopsy, but I think duodenal biopsy is the gold standard.
Yes.
And okay, that was a wrong. And may I ask you another question now? That you asked how to follow up clinically.
Okay. Follow up first. Advise a dietary exclusion, and again we will follow up her at 3 or 6 months interval if with a biopsy. There will be growth of the villi with dietary exclusion, and also at that time we will do the antibody level.
Okay, so three things: do antibody level, advise on dietary exclusion, and then 3 to 6 monthly biopsy, endoscopic biopsy.
Yes, 6 months,
Oh,
not 6 monthly, just once that if it has grown or not. If she follows the advice, it will
hmm.
usually be come to normal. And if with follow up of advice, if this is not coming to normal, then there might be something else. So I'm going for the next case.
Yeah, yeah, yeah. Okay, yeah. Recording stopped.
No.
Recording going on.
Yes.
Okay. So, well, can I ask you one question about the previous case?
Okay.
That did I have to do anything more for the examination purpose? That is the examination part, or was it all right?
Okay. Yeah, you want permission to examine her back because she had some rashes on the back.
Okay. Okay.
During diagnostic examination, you could have asked for that. Okay.
Okay.
Are you ready?
Yes.
Start.
Hello, I'm Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
My name is Ashley Zard and I am 27 years.
Okay. How may I address you?
Please call me Ashley.
Okay, Miss Ashley. Today we're going to discuss about your health issues. Is that all right?
Okay, doctor.
Okay. At the beginning, can you please tell me what have brought you here today?
For last few months, doctor, I have been noticing that I am being more tired and easily fatigued, and the condition is deteriorating day by day. So I visited my GP. He ran some tests, and he didn't find anything abnormal with that. So he sent me here.
Okay, I can get you, and I will try to find out the cause. Okay, can you please tell me that what exactly do you mean by weakness or tiredness?
I feel lack of energy, doctor. Whatever I would do before, I feel
Yeah.
petty with those job now.
Okay. Okay. May I ask you some questions now? That did this come along? This fatigue or tiredness? Did this come along suddenly or gradually?
Gradually.
Okay. And do you think that it's present all the time now during the day or
Yes, doctor.
in specific? Okay. Okay. Do you think that there is any specific time of the day when it's worse or better?
No, it is present all the time.
Okay. And do you think that there is any specific body parts involved or the whole body is involved in this weakness or tiredness?
Whole body.
Okay. And have you found out anything that makes you feel better?
Taking some rest.
Okay. And anything makes it worse?
Working.
Okay. Okay. And okay. And may I ask you some other questions now? Do you have any raised temperature?
No.
Any headache?
No.
Okay. Any weather preferences?
No.
Okay. Any racing and pacing of your heart?
No.
Okay. Any shortness of breath?
No.
Okay. And do you feel any vision problem? Any double vision or something like that?
Yes, doctor.
Okay. For how long?
For last maybe 1.5 months.
Okay. Okay. And can you please tell me that when does this occur? This vision problem? Any specific time of the day, or is it
No,
always present?
all the time. I cannot see properly some object that is on my right side or left side.
Okay. Okay. And okay, some objects. Okay. And may I ask you that do you have any rashes anywhere in the body?
Yes, doctor.
Okay.
Some intimacy mark on my tummy.
Okay, for your tummy. And may I ask you some other questions? Now, do you have any shortness of breath?
No.
Any nausea chest?
No.
Any shortness of breath? Sorry, any chest tightness?
No, doctor.
Any chest pain?
No.
Okay. And do you have any joint pain?
No.
Okay. And you told that you had some rashes in your body. And may I ask you that have you been measured your blood pressure recently?
My GP measured it and he said that it's high.
Okay. Okay. And okay, can you remember it or just he told that it's high?
It was 150 and 90.
Okay, that's all right. And have you ever measured any your blood sugar level?
My GP also measured this time, and he said though it is not totally diabetic, but it is on the diabetic. It was 10.
Okay, 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 okay. And okay, and may I ask you that do you have any back pain?
No.
Okay, and have you ever felt any pain in your joints?
No.
Okay, and did you have any history of trauma recently?
No.
Okay, and may I ask you some personal questions at this moment?
Okay, doctor.
Okay, how do you smoke?
No.
Okay, do you drink alcohol?
No.
Okay, and how about your mood? Has it been all right recently?
No, doctor. I think that I am getting low mood, but I also have a lot of stress at work. So I don't know
I
if
can
they are due to that.
I can get it. And may I ask you that have you been have you ever seen anything that others don't see? Have you felt
No.
like that?
No.
Okay, that's all right. And may I ask you some other questions now that it's actually some personal question that may I ask you,
Okay, doctor.
do you take any pills?
No.
Okay. And have you ever been pregnant?
No.
Okay. And may I ask you that do you suffer from any other known conditions?
No, doctor.
Okay. Do you take any medication?
No.
Okay. Any over-the-counter medication?
No.
Okay. And do you have any family history of any diseases? Do you remember any heart diseases or any diseases of the chemicals of the body?
No.
Okay. Do you have lumps and bumps anywhere in the body?
No.
Okay. And okay. And may I ask you just what about your water work? Is it all right?
Yes, doctor.
And your bowel movement all right?
Yes, doctor.
Okay. Now I would like to examine the patient.
Okay.
Okay, at first I would like to have a look at his. I would like to have a look at his eye field. Okay, visual field testing, both on right and left eye, for to look at the waving finger. How is it? Right temporal hemianopia present or not?
Yes.
Okay, and then I would have to like to have a look at his hand to see whether there is puncture mark for blood glucose level.
No.
Okay, then I would have a look at the pulse.
78 beats per minute.
Okay, I would like to have a look at the blood pressure.
150 over 85.
Okay, and now I would like to tell the patient to stand up from sitting position without using his arms.
He cannot do that.
Okay, and okay, and I would like to have a close look at his back, whether there is any problem present in the back as well.
A slight bump present on the neck.
Slight bump present.
Yes.
Okay, okay, and I would have to just listen to the heartbeat by auscultation.
Normal.
Okay, and I would like to
Minutes remaining.
listen to the wheeze. Lung filled.
Normal.
Okay, any edema present?
No.
Okay. May I know at this moment what your concern is?
Why I am having this, doctor? It is affecting my job. It is affecting my daily life.
Okay. Okay. Well, may I ask you some other questions at this moment?
Okay, doctor.
Okay. Have you ever? You told your water is fine, but have you ever felt that there is any blood coming out from your water bottle?
No.
Okay. Any blood through your bowel movement?
No.
Any blood through your sputum or any while coughing out? Any coughing out
No.
of blood?
No.
Okay, you told that there was no loss of weight, but do you have any lumps and bumps anywhere in your body?
Doctor, I haven't told you that I'm not losing weight.
Sorry.
I have gained weight.
Okay, you have gained weight. Yeah. Okay, that's all right. Okay, at this moment, as long as I have examined you and taken history, I think that you might be suffering from a condition named Cushing's disease. Okay, don't bother about the term. Actually, there is a gland in our brain that produces chemicals or what we call hormones, and sometimes it can uh, produce some hormones like stress hormones in more amount. I think that it's the case
Time
in your
up.
okay.
So what is your diagnosis?
I think that the person is suffering from Cushing's disease, Cushing syndrome, most probably due to Cushing's disease.
Uh, do you have any other differential diagnosis?
Uh, I think it can also be ectopic ACTH syndrome.
Okay.
And considering his weight gain, it can also be hypothyroidism, I think.
Okay.
And it can also be panhypopituitarism.
Okay.
And I cannot remember now.
Do you think polycystic ovarian syndrome?
Yes.
Metabolic syndrome?
Sorry, what syndrome?
Metabolic syndrome?
Yeah, I just
Acromegaly?
completely missed it.
Acromegaly?
Yes.
Okay. So I will investigate her.
I think at first I would like to do some routine blood test, including the complete blood count, where I can get less basal eosinophil and lymphocytes, I think, and then I can also do some ESR and CRP. Then I might have to do overnight dexamethasone suppression test. Oh, sorry. Before that, I should do serum creatinine and serum electrolyte level to find out. I think hypernatremia and hyperkalemia, and then I would have to go for overnight dexamethasone suppression test to confirm Cushing's at first. And after confirming Cushing's, I might go for ACTH level to find out whether it should be pituitary involved or not. And after that, I might do for some pituitary MRI as well. Okay, to find out whether there is any gland abnormality or not. and also I might have to do CT abdomen and CT chest to find out any distal foci for ACTH secretion.
Do you think of doing a fundoscopy?
Yes, of course. I missed it.
Serum IGF-1 level.
Yes, serum IGF-1 level fundoscopy.
Have you mentioned urine for routine examination?
Sorry.
Urine for routine examination.
Oh, I missed it. Yeah.
Okay.
Sorry, can I ask that is fundoscopy part of investigation or examination?
Examination, you haven't examined it, and even in the investigation, you haven't mentioned it.
Yeah.
So I'll manage that if it is a case of pituitary adenoma.
I think the most specific management would be surgical. However, a transfemoral surgery, I think. However, we can also think of patient education and counseling at first. Then I would have to involve the multidisciplinary team consisting of occupational therapist, occupational health service, then also endocrinologist and ophthalmologist as well. And then I would have to the specific treatment and treatment of complications. The specific treatment should be surgery, transfemoral surgery, and also treatment of complications, including maintenance of electrolyte level, and also maintenance of blood pressure and maintenance of blood glucose level. This should be important, I think. Okay.
Do you know any complication of removing adrenal gland for treatment of Cushing disease?
Well, if we actually fail to do this through the pituitary gland, we might have to do that bilateral adrenalectomy, which was done previously. And in this case, I think there will be excess ACTH level in the blood, and it can cause excess pigmentation named Nelson syndrome.
Okay, that is fine.
Okay.
Thank you.
Okay.
Okay, on this case, I have a few things to include. You haven't asked about weight things.
I asked later on.
Very later, and you mentioned that you said you have not lost weight or by something. Okay.
Yeah.
You means that if you asked it earlier, you could get it, and also after getting asking the weight gain, where did you get weight gain? Was it all over the body or some part of the body?
Yeah.
Is it bruising and is it bleeding? You have asked it. Okay, for Cushing's, you have asked almost other things. You haven't asked. You have after going for the presenting illness, you went for the personal history. That wasn't very important. You didn't went for the past history, family history before that. And also, you haven't asked about her period.
I asked about period, I think.
No, you have asked about any taking any pill, any pregnancy.
Okay. I just forgot. I in the mind, I thought that I asked.
Okay. You did well.
Okay. I did well because the case was actually directly Cushing's. But if it had been acromegaly or metabolic syndrome, I think that then it would have been difficult for me. Or PCOS, because I haven't asked about her menses.
Okay, and for Cushing's disease, there might not be apparent of all the symptoms like that is called what is called hump or dust like thing, and protrusion of the abdominal strap all may not be present.
Yeah. Well, another thing.
The typical symptoms may not be so apparent, and also on examination, the physical the symptoms for on investigation, the hyponatremia and hyperkalemia, this is usually rare.
Okay, and I think in some persons, I think whether if it was PCOS, then the history, I think, would have been almost the same. And what would have I done?
There was no involvement of the patient at that time. You should have asked about must have asked about the
Menses, fertility,
menstruation and acne problem.
acne.
Yes,
How should I asked about acne?
any rash on the face.
That is very important. Okay. And for metabolic could have also come almost in the same history
Yes,
with the same history. Then what would have I done?
and acromegaly.
Yeah,
All,
acromegaly, I think. Yeah,
all,
but
of,
for
all of them were almost suggestive of all of those. Only one or 2 points that were not in favor of those.
yeah. Okay. Okay. Actually, it was although I cracked the case, but actually it is not easy one because
Yes.
the case was easy. But if
And
it was been
patient's initial symptom was somewhat vague. That wasn't something straightforward.
sorry,
Initial symptom was vague, and this lady, and you haven't asked about her occupation, I think.
yeah, no, she told that she was actress. I think.
The first case was actress.
Oh, okay.
This lady was also, this lady worked as an office assistant, and she had to maintain her weight. But recently, she is getting weight. Those, and she is also on makeup, so
Yes.
that cannot be understood.
Yes. Okay.
Okay.
Okay.